an interesting tidbit to start. I speak with a lot of colleagues in the field, folks that are supervising younger clinicians early to
Right.
the field. They are already starting to use ChatGPT during their session. So they may be seeing
Oh,
clients online. They've got ChatGPT pulled up. They're not sure how to proceed. They have a question about what to do next. Now, there's a concern about multitasking and divided attention, but they're getting cues or prompts to integrate into their session as they're working. So this is just
oh,
in the wild how younger people are already playing with the technology. What I was happy to hear from the director of this clinic was that they were concerned, they were curious, they were monitoring what this was about, how this was going to change therapy outcomes, client outcomes. What's great is this is a clinic that is collecting data about how clients are doing each session, how's the alliance, symptom inventory, are they improving? So they're
hmm,
not seeing it negatively impacting client
hmm,
outcome. So that's interesting. But now
hmm.
imagine the very, very advanced form of that, where you really have products that are created to support clinicians, where there are prompts on the side to say, oops, we've heard
Oh,
this emotion. There seems to be concern about depression. Can you, here are some questions to start evaluating for this diagnosis or for, a crisis assessment, right? There are things that we miss as clinicians. What would it be like to have prompts if we have
hmm,
ambient AI listening to our sessions and it is picking up patterns, picking up emotions, picking up responses from the client, words, phrases that are patterned to certain behaviors, certain diagnoses? It can cue us to maybe redirect, right? And have a more productive therapy session, or to more accurately diagnose a client. What can we
hmm,
learn? I think of AI, the potential for it, right, as this additional thought partner. It's augmenting our clinical skills. What is it picking up that we may not pick up, right? Because it's designed to pick up so many patterns that we can't see. Like there are
right.
tools right now that pick up all of the different emotional components of a session, second by second. Oh, the client is feeling this percentage of determination and this percentage of curiosity and this percentage of happiness, right? And how does that shift throughout the session? And how does it shift based on the therapist's intervention? And
Hmm,
then we can go into the psychotherapy process research around what combination of emotions and interactions between the therapist and client predict positive outcomes, right? There's so much data that we can collect and analyze and evaluate to see what's working, compared to historically, how have we done psychotherapy process research? We've recorded a session, we've trained somebody in how to code that session for different variables. It
hmm.
takes hours and hours and hours to code a psychotherapy session. But AI, you give it the rubric, the instructions for how to score, and it can evaluate so much of what is happening in a session.